Everybody get comfortable. We've got a bunch of questions that were collected from the community, okay? And this is about learning how to be healthier during our pregnancy, after a pregnancy, so we have healthy mothers and healthy babies. We'll start off with Dr. Tano. One of the questions that came in is, as a healthy, fit young mom, why is a level 3 NICU or neonatal intensive care unit important to me?
St. Mary's has been doing neonatology for more than 50 years. So one of the questions that's always asked to me, where should I deliver? And I think a lot of times it's overlooked whether your hospital has a level 1, which is a newborn nursery, a level 2, which is really just stabilization of high-risk patients, and a level 3, where you can take care of all the particulars of a premature baby, a complicated baby, a child that needs neonatal surgery. And St. Mary's, it has the most experience in Palm Beach. It's the oldest neonatal unit in Palm Beach. So people always tell me, I'm going to have a normal delivery. I don't need a level 3. But unfortunately, that's not always in your control. What you expect to be a normal delivery becomes a problem during the delivery, and that's something you cannot predict. So we call it a postpartum diagnosis. And what that means for the lay people in the community means after your delivery, you can call your delivery normal. But prior to that, you really can't control it all. And so there's lots of complications that occur during delivery. And with St. Mary's, you have the luxury of having a neonatologist sleeping in the hospital 24 hours, 7 days a week, Christmas, New Year's, every holiday. In the event, God forbid, you get to know what a neonatologist is. Because most people go into delivery not even knowing what a neonatologist is. In fact, if I see one in the community and I tell them I'm a neonatologist and they know what it means they've had an experience. And that's not uncommon. So it's an insurance policy with the highest level of care. Very few hospitals in Palm Beach have the amount of care, level 3 status that we have here in West Palm Beach.
Thank you, Dr. Tano. I think that leads us right into Dr. Altizer. So very similar question, but maybe you can add on to this on the pre-delivery portion, or, we only diagnose after delivery if it's normal or not. Why should I choose to deliver here at St. Mary's, and what services, maybe from the OB perspective, make this the preferred choice?
Absolutely, that's an excellent question. And just to expand on what Dr. Tano said, I think we have something very special here at St. Mary's. During my 20 plus years of practicing, I've been in a variety of academic hospitals, and I have to say St. Mary's is at the absolute top when it comes to OB care. We have 24-hour a day, 7-day a week obstetricians in-house on the unit, so we can meet any emergency needs or demands that our patients may have. In addition, as Dr. Tano said, we have our NICU readily available. We have 24-hour access to high-risk perinatal maternity care. So in the event that we have a mom that comes in with a very high-risk pregnancy condition, we not only do we have OB hospitals to take care of this patient, but then we have expert high-risk pregnancy care available 24/7. Beyond that, we have here at St. Mary's a wealth of other resources, including expert critical care teams, trauma team, so we can provide care for moms experiencing a variety of issues, even outside the scope of obstetrics. So I think, St. Mary's is absolutely the place I would want my family to be if they were delivering.
Thank you, Dr. Altizer. And that actually leads into a question that we had for Dr. Stoessel on a high-risk OB with a lot of experience with high-risk pregnancies. So what specific risk factors or complications classify a pregnancy as high risk, and how will they be managed during the pregnancy?
There are many different factors that define high risk. And you could be 16 years old and have a high-risk pregnancy. You could be 16 years old and have a high-risk pregnancy. You could be 50 years old and it is a high-risk pregnancy. And there's a lot of different factors: diabetes, high blood pressure, twins. I saw twins a while ago in consult. History of premature birth, history of uterine surgeries. The litany of things go on and on and on. There's never a dull moment when you do high-risk obstetrics. Now, one of the reasons why I've been on staff here since '97, and one of the reasons why I continue to practice here is because you have all the various components necessary to be able to take care of patients from all different levels. Our catchment goes out to 7 counties, and I've delivered many, many babies with birth defects that will need surgeries. And the NICU has been very accommodating to get those babies in, get the pediatric surgeons to see the children, and then have the surgeries done. There's another area that I specialize in is mothers with poor pregnancy outcome. So when I came to Palm Beach County, I was faced and inundated with quite a number of women coming to me because of many different complications with their pregnancies. And one of the areas that we worked on is to make sure that we can create that access for any mother that needs advanced care, whether it's a history of stillbirths, recurrent pregnancy miscarriages, neonatal complications, et cetera. The litany of things go on and on and on. And also, because of what we do, we are the backup for about 80 to 90 OBGYNs in the county. So when they have a patient that's extremely at risk, they refer them to me, our team, and then we work with St. Mary's and Dr. Altizer, the neonatologist, to make sure that care is comprehensive and seamless, meaning that the patient don't have to do anything other than just be here. We are going to take care of all the various things and update them on an ongoing basis. So we communicate with the OBs, we communicate with the neonatologists, we give them the data points that's needed, we communicate back and forth, update the patient, update their family. So it really becomes a very comprehensive approach to cut down on the anxiety that's created when you're in a high-risk situation. And I just admitted several patients that are very high risk, and Dr. Altizer and her team has been very, very good in communicating with the patients, and they're really satisfied with the level of services that's being provided.
Thank you. I think we've got like 2 follow-up questions on that because that was a lot and very important information for us. So how do I know when it's time to go to the hospital? That was a question that was actually asked. How do I know when it's time to go to the hospital? There's all these follow-up appointments and whatnot, but.
Well, that's not something that per se the patient to decide necessarily if you have a private physician. If you have a private physician, whatever is going on with you, you call them, speak to them, and they will guide you in terms of what to do. If it's an acute emergency and it's after hours, you can't reach anyone, then obviously we always say go to the closest maternity hospital, and then they'll take care of it from there. I've done that many times, and the patient gets stabilized and then transferred to St. Mary's for advanced care. So it really is up to the patient, but then you have a private physician can help guide you with that. And I've also seen where patients call labor and delivery at St. Mary's and speak to whoever is on call, and they help to triage the patient in terms of where do you need to go for care? Do you need to be admitted? Do you need to come to the hospital right away? You follow up with your private doctor, et cetera.
Thank you. I'd like to ask Amy Jacobs, our Director of Women's Services, a follow-up question. I think everything's tying along seamlessly and everything is connecting. So, Amy, a question came through. We've got all these appointments and all these visits that have to happen during the prenatal care portion of the pregnancy. So a question came through, what if I don't have the means to take care of preparing for this pregnancy and this new addition to the family? What are the resources that exist? What can I do to take care of myself?
That's a phenomenal question, so thank you for sharing that with us. First and foremost, I want to assure you that if you choose to come to St. Mary's Medical Center, we are here to take care of you. Doesn't matter where you come from, what you have, our priority is to make sure that you and that your baby are here, taken care of safely, and have a safe delivery. We have the care team, as evident by the crowd around me, to be able to successfully do that. We are also very lucky in Palm Beach County that the Department of Health focused on St. Mary's Medical Center and the Palm Beach Children's Hospital to receive a grant. And through this grant, we are able to reach out to our community and make sure that the resources are readily available for those that need. If you have a friend, a family member, a client who is in need of help, in need of a ride to get to the doctor, in need of supplies to help take care of them during their pregnancy, please have them communicate back to us here at the facility. My name is Amy Jacobs. You can easily find me at the hospital, and we are going to help connect you to those resources to keep you and your family safe. And that doesn't just end at delivery. We want to make sure that our moms are safe through the postpartum period. So 1 year after delivery, we are still very concerned about your well-being and want to be there to help support you and take care of you.
Thank you, Amy. So, Hong, our pharmacist, I think this is a hot topic over the last couple of years. So, are vaccinations safe? And are there any I should get or stay away from?
So I think the general consensus for vaccination in pregnancy that the only vaccine that you should avoid during pregnancy is a live vaccine. Anything else is safe for pregnancy. It is actually recommended that if you have the ability or if you do for vaccine, that you take them. On the market right now, we have very little live vaccines. So that is your smallpox, your chickenpox, your MMRs, which should be already delivered. Already, you get vaccinated with them when you are much younger. One of the vaccines that's definitely necessary during pregnancy is your Tdap, and it's usually administered to you during your, I think, between 27 to 36 weeks of pregnancy. And the reason for that is because it have a very shorter life of efficacy. So to make sure that that is passed on to your baby at delivery time. So if you get that before the 27 to 36 weeks, it is a recommendation that you revaccinate with the Tdap.
On that note, is there any vaccines that are specifically suggested for family or for my parents or any caretakers that'll be around the baby that they should be vaccinated as well?
So for a lot of the vaccine that is renewed every single year, so your booster, your flu vaccine, your COVID vaccine, as you know, when the baby is young, we don't have the evidence to administer a lot of the vaccine for younger babies, and they are at risk for infection. So if you take vaccine to protect yourself, it's also limit the transmission to the baby, especially at the younger age. So if you have the ability, you have the resources to get vaccinated, to stay up to date with vaccine, that we recommend that you do to protect these infants.
Thank you. So, Dr. Altizer, I know and you know that St. Mary's has been recognized for the low C-section rates here, and that's something that we strive for. That's a goal, and we've achieved the target. We've been recognized across the state of Florida as being the top in managing our C-section rates. So, what's the likelihood I'll need a C-section, and how do you approach this decision-making regarding delivery methods, whether it be vaginal birth or a C-section birth, specifically in high-risk pregnancies?
Well, thank you for that question. I think that's a question that a lot of expectant mothers have. Obviously, we are very proud of our C-section rate and the recognition that we've received. We always prefer for moms to be able to have a vaginal delivery if possible. It's a quicker recovery time, in a lot of instances safer. However, you know, in certain high-risk pregnancy conditions, either for the maternal consideration or consideration for the baby, sometimes a C-section is necessary. And that is a decision that we approach in a collaborative manner with our high-risk OB docs like Dr. Stoessel and with our neonatology team, and then with our OB hospitalist. And we love for the patient to be an active participant in that conversation to determine the best method of delivery. So our goal is always going to be, when safe for the mom and baby, to have a vaginal delivery. But when the need arises, you know, either for you know, maternal reasons or for fetal reasons, we are ready and available to provide safe C-section care as well.
Great, thank you. While you have the mic, this question was a frequent question, so we're kind of switching topics here.
All right.
So, is it safe to continue intimacy with your partner during pregnancy?
Great question, and certainly one that we get a lot. So the answer is most of the time, yes. If there are situations that develop during pregnancy, such as preterm labor or bleeding, then oftentimes a patient's provider will have her avoid physical intimacy. But unless there is a complication with the pregnancy, in that regard, usually it's safe to continue physical intimacy. But you know, patients should always check with their provider just to make sure they don't have any conditions such as, you know, where the placenta could be laying over top of the cervix, or any high risk factors for preterm labor.
Thank you.
Absolutely.
Another topic that came up a lot, Hong. So, what can I do for stretch marks? Don't we all want to know that? What can I do for those stretch marks?
I think there's a lot of commercially available products out there that claim that they could, prevent you to have stretch mark or to make them disappear. I think really the goal would be preventing stretch mark, and I think your old school coconut oil would be the best. But I think the best way to do it is to be consistent with it. I think a lot of it is because we don't apply it consistently. So I think consistency over intensity for coconut oil to prevent stretch mark is the answer.
Thank you. All right. Stretch marks to breastfeeding. Abigail, our lactation consultant, can you educate us on breastfeeding? I understand that breastfeeding is better than bottle feeding, but I've had problems before. This is my first child. Could you educate us on the benefits of breastfeeding?
Hi, thank you very much for that question. I would say that the majority of problems or problems that you have heard about from other mothers are typically solved through education, preferably antenatal education. It's really great to start learning about and thinking about breastfeeding during your pregnancy. There's a lot of information. And another really common problem a way to avoid it is a proper latch and positioning, which is something you can learn. I think that the majority of problems come from a mom having expectations that may or may not be realistic to her circumstance. So I always like to start from the point of a mom's, what are your goals and how can I help you meet them?
That's great. Thank you. Are there any dietary or lifestyle factors that can impact breastfeeding? And how can I optimize my nutrition and hydration for breastfeeding success?
Excellent. Well, as with everything, lifestyle and nutrition is key, right? So it's no different when it comes to making milk for your baby. Oftentimes, something's wrong with this mic, but anyway, oftentimes we are underhydrated and we don't even know it. We live in a very, humid, hot climate. So I'm always encouraging everybody, especially my pregnant moms, to drink enough fluid. If you don't like water, sauce it up with a little tiny bit of lemon juice or apple juice or whatever. As far as nutrition, my favorite thing to say is eat the rainbow. The darker and more colorful your food is, the more phytonutrients are present. And a lot of people say, oh, I'm a picky eater. I don't mean you have to eat that every single meal, but just make sure that you're eating things that are dark leafy green vegetables, that you get a lot of vitamins through what you eat if you eat well. So thanks for that.
I guess it goes with you are what you eat, right?
I love that. Yes, you are what you eat. In fact, I actually have that photograph of a breastfeeding mom. Your baby is what you eat.
Thank you. Right, makes sense. Thank you. So, Amy J. Yes. This is my first baby. What should I expect here when I deliver at St. Mary's? Can I bring my other children to the hospital if it's not my first baby? Can you describe the entire experience? What's it like?
Well, I can try to explain the entire experience. But first and foremost, I want you all to know that if you see people today in this area wearing a pink shirt, they are part of our phenomenal team of women's services. And this is a team effort. And thank you for the applause. Absolutely. And with that comes a tremendous amount of continual education, trainings, and learnings on a daily basis to make sure that we live up to the best of the Palm Beach County's Maternity and Child Care Center. And so if you do come into the hospital and you are scared and you are timid and it is your first baby, I can assure you that the care team here are going to teach you and walk you through every step of the way and alleviate your fears as you enter further labor and then, of course, your postpartum period. Having education, of course, on the outside brings you in prepared, but it is not something that is necessary to have when you come in. In regards to having your children here, we are a family environment. We are the Palm Beach Children's Hospital, of course, right? We want you to come here. We want your family here. We want this experience to be holistic and inclusive. What we do ask, though, is that your children not stay overnight. And if there is an emergency, please keep in mind that there should be somebody available, readily available, to take your child in case there is an emergency and our care team needs to be very focused on mom.
Thank you. Megan, we've got a couple questions for you, and I know that these are some of the tough questions and hard topics to talk about, but I think it's real. I know it's real, and I know if we have moms out there that this is not their first child, this is something that we need to educate ourselves on. So a question that came up frequently is, I've heard about postpartum depression. I'm an overall happy person, so what are the warning signs that I should be aware of, my loved ones should be aware of, that we can educate on?
Thank you. So postpartum depression is something to take very seriously. It differs from a regular diagnosis of depression that's not involved with somebody having a baby, because the emotions are intensified. So if you have recently had a baby and you are starting to feel even more out of the norm than you would expect. I'm sure everybody's Googled. I'm sure everybody has talked to people who have had babies. So you kind of have an idea of what to expect when you go home with your new bundle of joy. But some warning signs for postpartum depression are the inability to sleep outside of what would be seeming as normal when you have a newborn. It is feelings of rage, feelings of self-harm, and feelings of potential harm to the child or to the other children in the home. It's also disengagement. And if there's anybody who feels that way, there are a lot of resources here today that can help connect you to where you need to be and how to get support for something like that. The biggest thing that I want to drive home with postpartum depression is that it's very real. And it's something that a lot of people experience. 17% of women who have a child experience postpartum depression. Symptoms can go from 1 week to 4 weeks to up to 2 years or even longer if not treated. So it is something to take very seriously. When you bring a child into this world, you want to love them with all you've got. And so you got to be right too.
Thank you. So along with that, if it's not your first child and it's your second child and the hormones are causing and intensifying emotions, what do I do when I'm overwhelmed? And is there something with sibling rivalry? How do we cope with that?
So feeling overwhelmed just in everyday life, if you take kids out of it, is completely understandable and normal. It's a very normal feeling. I think that when you think that you need to be super mom and do everything for everyone, it intensifies. And so being able to lean and have support from your family. If you don't have family in the area, your community, if you look around you today, these are the people in your community that are here to support you. So really relying on them. And if you're feeling overwhelmed, sometimes the simplest things that become the best types of solutions. So one of the easiest things that you can do if you're feeling overwhelmed is get a cold glass of water, because a cold glass of water just kind of brings you back down to reality. You take a couple deep breaths and then you move on and you move forward. If that baby is crying and you haven't gotten sleep and you don't know what to do, that is the simplest thing. Everybody's got a cup, everybody's got some water. Just get a cold glass of water, take a couple deep breaths, and remember that you can do this. After all, you did birth the baby. If you can do that, you can do anything.
Awesome. Woman power, right? Woo. Okay, Dr. Tano, so baby's born. We all want healthy babies, but in the event that things pop up, get an accident, break a bone or something, what kind of subspecialties do we have here at Palm Beach Children's Hospital?
So that's what distinguishes us from all the other hospitals in Palm Beach. Being a level 3, we have all the pediatric subspecialties. The neonatal unit, we just talked about postpartum depression, so I don't want to scare anyone and make anyone depressed, but our neonatal unit can take care of babies that are less than a pound, that have maybe 30 cc's of blood. We transfuse them with only a teaspoon, and we can take care of babies up to 10 pounds. So it is a very specialized unit and with the best nurses in all of Palm Beach. They're working in the neonatal unit for a reason. It's challenging, absolutely.
The best nurses?
Best nurses and neonatal nurses.
Can we get a shout out for the best nurses and neonatal nurses?
Which is a very important component of a level 3 neonatal unit because they're by the bedside identifying problems. Having said all that, we have all the complements of pediatric subspecialists. Starting with the surgical, we have pediatric surgeons. We have 11 pediatric anesthesiologists. There are hospitals in our community that don't even have one. And when you take a baby that's 500 grams to the OR, you need the best anesthesiologist, pediatric urologist, pediatric ortho. I'm sure I'm missing something in this pediatric ENT. Most other hospitals in Palm Beach do not have those specialties. We have cardiology, we have pediatric infectious disease, pediatric nephrology. Most other hospitals in this community cannot do dialysis for babies in the neonatal unit, but we can. Pediatric endocrinology, pediatric gastroenterology, and neurology, and hematology oncology. So that is part of the secret sauce that St. Mary's has and the Palm Beach Children's Hospital has that the vast majority of hospitals in this community do not have. On top of that, we have a dedicated neonatal transport team. So let's think about that. If you have a transport team, it's because people are having to send you babies. We're not sending babies out. We're receiving high-risk babies from other hospitals, okay? Which is a testament to, obviously, the quality of the neonatal unit. And on top of that, which has not been mentioned here, that we're the only hospital with a RIPIC status. And that stands for Regional Perinatal ICU. That means all the high-risk moms in our community that the other hospitals, I wouldn't say panic, but they transfer to us for obvious reasons because we have the ability to take care of them with the first laborist program in Palm Beach. And for the folks that don't know what that means, a laborist is an obstetrician, again, that sleeps in the hospital 24 hours. We've had that at St. Mary's way before any other hospital in the community had. Why? It's not cheap, but it's for better quality, better care, and it's a synchronized care. So 1 in 10 deliveries will be admitted to the NICU. Unfortunately, I hope I was put out of business, but there are many reasons to be admitted to the NICU. It could be congenital abnormalities, it can be infection, it could be a large child that cannot transition into a newborn nursery. But the beauty is that we have all the resources again in our NICU, and it's the best in all Palm Beach.
And we know we just got voted the best.
That's right.
In all of Palm Beach. So this is a center that can take care of high-risk pregnancies. We have physicians who are educated and trained and very experienced in taking care of moms of all walks of life, high risk, normal deliveries as well. They're born, we've got the safety net, and you said the insurance policy of having all of those specialties in a level 3 NICU. We've got the Palm Beach Children's Hospital. We are here in Palm Beach County as the hospital of choice, and happy and very healthy babies and moms is what we want to have, and we are here for you. Does anybody have any questions from the group here that you'd like to ask? We got all of our questions. We've got all of our questions from the community that we gathered, but if there's anything else that you'd like to contribute or any other questions that came from the group who's here today, we would like to take those at this time.
Jess, I'd just like to say one final thing to build off of what Dr. Tano said about our nursing staff. All the people around here with these bright pink shirts on are definitely the heart and soul of our unit, and are the people that make the real magic happen at the bedside with you during your labor, and are the first to recognize when there's a problem and to call the docs right away. So, you know, we have all of the puzzle pieces to make the birth experience an amazing experience, and it starts with our nursing staff, both on the labor unit and in our postpartum unit. So thank you guys for everything that you do.
Thank you, Dr. Altizer. Dr. Stoessel, you wanted to add on to that?
Yeah, I agree with that, Dr. Altizer, fully. I've been working with the antepartum nurses. That's mothers admitted with pregnancies that are complicated, and I've worked with them for 20 odd years. They're the greatest, highly achieved nurses I've ever worked with my entire career. And I've worked in many, many hospitals in New York, Miami, etc. They have saved so many lives by recognizing issues and problems and bringing it to our attention. I wrote about it recently on LinkedIn that some of the greatest nurses I've ever worked with are in this hospital. And every time I see them, It's like a family get together.
Can we get another round of applause for the pink shirts out there? Thank you to our nurses, lifesavers, real lifesavers. And I mean, it's definitely a team. We are so fortunate to have this group of physicians and this medical staff here that we collaborate, and it's a total team effort. Thank you. So we want to thank you for coming today. And again, St. Mary's Medical Center, we deliver for you. We are stronger together. This is a community of partners that we want healthier, happier moms, healthier, happier babies. We are here for you, and just so happy that you all came out today.